Hi, welcome back. Today we will see the best acne treatment you can try for pimples at home. Yeah, I'm telling you all the secrets of acne care. I'm a practicing skincare doctor. Most of these are drugs that you can buy without a prescription. This video will show you how to clear skin, saving hundreds of dollars and the time you spend consulting doctors and drugs. Emma is here. See how desperate she was 1 month back when she first visited my office? Whiteheads, blackheads, red bumps, pus-filled blemishes, acne scars, and dark spots. All types of acne. Her 4-week-long skin journey where she learned the real meaning of the phrase, trust the process of acne-free skin. Almost cleared skin, happy and confident. I will clear your acne breakouts. Every pretty girl I know has acne, so if you have pimples on your face, just know it's probably because you're pretty. You would be glad to see the video till the end, and I'll tell you all the over-the-counter medications you can try without a prescription that will give you marvelous results. It's necessary to treat acne properly to prevent these types of acne scars. Yeah, they are challenging to treat, but I will show you how to treat them. And my permanent acne treating method for you as a gift. Let's start with one of the best over-the-counter products, 5% benzoyl peroxide gel. Acnicide gel and Pirigo gel are common brand names. There are many products worldwide, so you can try a gel with benzoyl peroxide available in your country. Containing benzoyl peroxide. I will list all drugs I describe in this video in the description box, so you don't need to write them now. You must know how to apply and get a pea-sized amount on your fingertip, which we have to make a thin film to cover the entire face. I'll show you how to do it. One for forehead, one for right cheek, one for left cheek, one for nose, last one for the chin. Gently apply the cream to make a thin film. Do not rub vigorously, be gentle. You can use this at night before going to bed. So one common side effect with benzoyl peroxide is a burning sensation. But most of the time it's due to the application of too much gel. See how she applies it? Oh, too much. You will understand why most get irritation and redness. You will be confident with my method. Try it and let me know. What will benzoyl peroxide do for you? It will target the bacteria inside the pores, leading to painful pus-filled bumps. These are the cause of most pus-filled blemishes, so we are clearing them up. Your excess oil and sebum will sweep away. One of the harmful things is dead skin blocking the pores, which will also be addressed by benzoyl peroxide. It will clear your breakouts for sure. Comment below on how this works for you. It has worked for thousands like you. Its results are apparent in 2 weeks, and you will notice a drastic reduction in existing blemishes, reduction in new. It's safe during pregnancy, so there's no need to worry if you plan for pregnancy. Safe for both males and females. And if a large area is affected, like the chest and back, I recommend you use 10% benzoyl peroxide wash in the morning in addition to our routine. 0.1% Adapalene gel is the next option. Differin gel is a good product with Adapalene. There are many products worldwide, and you can try a gel with Adapalene available in your country. This stuff you can get without a prescription. You must know how to apply. Get a pea-sized amount on your fingertip. What we have to do is make a thin film that will cover the entire face, as we did with the benzoyl peroxide. One for the forehead, one for the right cheek, one for the left cheek, and one for the nose, and the last one for the chin. Then gently apply the cream to make a thin film. Do not rub vigorously, be gentle. You can apply this at night before going to bed. So I recommend you use it every other night with Adapalene. We are alternating 2 gels at night. What will it do to your blemishes? Your excess oil and sebum will be swept away. One of the harmful things is dead skin blocking the pores, which will be addressed by Adapalene. It will target the bacteria inside your pores, which leads to painful pus-filled bumps. These are the cause for most pus-filled blemishes, so we are clearing them up. You will get a clear face with these steps for sure, and it's guaranteed. Results will be more rapid if we combine both. But we have to do a few other things. A good cleanser is crucial to preventing breakouts. You must get a good one to have results. Cleansers formulated with salicylic acid and glycolic acids, the best ones in the United States and Europe, are Cetaphil Acne Cleanser, Effectla Salicylic Acid Cleanser. Wet your face with lukewarm water, use your fingertips, and gently apply to cleanse. Don't rub vigorously. Don't scrub the skin. Pat dry with a soft towel. Limit washing to twice a day and after washing daily. You can try a good cleanser available with salicylic acid and glycolic acid in your country. It deep cleans to clear breakouts, remove dead skin, reduce bacteria, and unblock your pores. It starts to work immediately to reduce your blemishes. You can cleanse twice daily to avoid overwashing, and after cleansing, you can apply benzoyl peroxide or adapalene at night. So these are my secrets. You can try it and share your experiences with me. If you feel troublesome switching to benzoyl peroxide and adapalene alternatively at night, you can have a gel like a P-Duo gel. It has benzoyl peroxide and adapalene so that you can use it every night. It is less troublesome for you. Adapalene is not recommended in pregnancy. In the morning after cleansing, I advise you to apply a non-comedogenic cleanser. In other words, it doesn't block your pores, so there are no acne breakouts. You can apply a good moisturizer like Cetaphil. It will nourish your skin and protect you from bacteria and external allergens. We are exfoliating skin with cleansers, so we have to protect and nourish it. In the next few minutes, I'll tell you how to clear dark spots, acne scars, and my top secret how to clear acne permanently. Some of these methods you can try at home with over-the-counter medications you can buy from anywhere in the world without a prescription. I will show you a permanent way to clear acne. Why do you get acne? It's due to inflammation of your hair follicles, mainly oil-producing glands, which we could destroy these. Yeah, it can be done. So we will burn it out with a small electric current. You won't feel it because I've applied anesthetic gel to numb your face. If you don't have oil glands, there's no more acne. That's what we're doing here. This is much cheaper than a laser and it's permanent. You won't get acne again, and after the procedure, you can apply an antibiotic cream for a few days to prevent bacterial infection. That's it. This is Ginny in 2 months. Can you believe it? Unbelievable results. What to do for blackheads and whiteheads? The easiest way to remove blackheads and whiteheads is to extract them with a comido extractor. It's the easiest method, and you can do it yourself. Benzoyl peroxide wash after the procedure as an antibacterial agent. What else can you do? A bit more advanced than the above steps is peeling. Next, top secret. Yeah, I'm unveiling all my tips and experiences with you.
Salicylic acid belongs to the beta-hydroxy acid family of acids. Great for zapping oil on the skin. When used as a peel, this type of acid is good for those who have pimples and acne. Because of its beneficial effects, salicylic acid is often used by dermatologists to treat skin concerns like acne. Let's see how to do it.
Today we're going to do a chemical peel, and we'll do a fairly mild to moderate peeling with salicylic acid. What chemical peels do is they exfoliate off the dead skin, which of course in turn brings new skin cells to the surface, causes your skin cells to prematurely slough off, so the chemical peels help with hyperpigmentation, helps with any acne breakouts. Salicylic peeling really truly leaves you with a nice refreshed look, so we'll go ahead and start peeling. 20 to 30. Salicylic acid is an over-the-counter medication that gives marvelous results for pigmentation and superficial scars. It is a keratolinic. It encourages cell turnover and helps to exfoliate the skin. It sweeps away grease and bacteria, help with acne getting better. Salicylic acid does superficial peeling of the skin. Start with 20% and moving up slowly to 30%. You can apply salicylic acid twice weekly. If you feel dry or irritation, you can add some moisturizers. It will soothe you. Start from right side of the forehead to the left side of the forehead, left cheek, chins, finally right cheek. You can apply 2 times if you are not uncomfortable. Avoid touching sensitive areas around eyes and lips. For edema, redness irritation, gently touch with ice packs. It will reduce in few hours. Skin peels in 2 days, leaving regeneration of new skin. Can switch to emollients as routine after the first 3 days. Please remember to wear sunscreen. It will avoid sun damage and skin redness. Complications are rare but can occur. Painful pustules can occur with bacterial infection. It has to be treated with antibiotics. Acne healing process is complex and it can ultimately give rise to pigmentation or scarring. Post-inflammatory pigmentation, or PI, refers to the color changes red, brown, black discoloration of skin areas where acne has been cleared. Here you can appreciate the color changes of the skin. How to treat pigmentation or dark spot at home. You can also try azelaic acid in the morning and night at areas of dark spots. Retinoids. Retinoids can reduce melanin synthesis in many ways, leaving a lighter skin. Tretinoin application once daily for 3 months will give you excellent results and bright skin. You can use tretinoin up to 10 months depending on your response.
I'm passionate about teaching you how to perfect your skin. A scar is with you forever, so this is a scar and those are forever, so you need to do treatment for it. It's important to identify the type of acne scars you have because treatment varies with the type of scar. So if you treat it inaccurately, it may leave ugly scars, which is more uglier than what you have. Acne scars not only a problem in the surface of the skin, inner structures, also called the dermis, is affected. There are 4 types of acne scars based on morphology, depth, and width. Number 1. Ice pick scars. Ice pick scars formed with a distinct outline. It's like somebody has taken an ice pick and has poked your skin, so those scars are a little more difficult to treat. Don't worry, we do have treatments for it. Number 2. Scars are broad, box-shaped scars with sharp edges. Number 3. Rolling scars are relatively shallow scars that give the skin a bumpy appearance. Number 4. Hypertrophic acne scars are thick and lumpy scars that result from overproduction of collagen. These are commonly seen on the chest, on the back, and on the shoulders. So those are scars which are raised, so when they are raised, that will be a different treatment. Now let me come to the treatment. Now the principle in these scars is that there is a dent that is left behind. The principle is we have to make collagen grow. So there is a hollow here, so we stimulate the collagen over here to grow. So there are many treatment options for different types of acne scars.
In this video, I'll be showing you how to treat really deep ice pick scars. To me, they're the easiest scars to treat. Remember, it's always the method and never the machinery that gives you the best results. This method of TCA cross works, and it works very well. This is how I performed the procedure. Not all acne scars are ideal candidates for TCA cross, but the deeper the scar, the better the result. So ice pick scars and deep acne scars are ideal candidates. So what we're doing with the TCA cross is that we're modifying the collagen. And what we're doing is we're laying new collagen by stimulating cells called fibroblasts. So TCA cross stimulates collagen production. Now this works by breaking down old collagen and laying down new collagen. I'm going to touch ice pick scars with 100% TCA soaked toothpick. These procedures usually repeat in 2 weekly till you achieve the target.
For box scars, 100% TCA cross, laser, and microneedling are the first line. Microneedling is that means with a derma roller or derma pen, the needles in stimulate your collagen and lots of products which stimulate your collagen, resulting in healing. Rolling scars, usually TCA cross not recommended. Subcision and laser are the first line. What is subcision? A needle is put under your skin, and you know whenever there is a scar, remember there is a fibrous band which is tethering your skin below. So it is pulling your scar, the base of the scar below. So subcision, what it does is the needle will break that tether, it will break it, and once that is done, we can inject PRP into it, and that also gives great results.
Laser resurfacing for acne scars. So the first step is planning and mapping what I'm going to do. Once this is done, you start layering, and this is done under sedation, so it's a painless procedure. In this case, I'm using a carbon dioxide laser. How deep should I go? The answer for it depends on how deep these guys are. So you can see me, I'm chasing behind scars. So if I'm under disguise, the scars will disappear completely. Once this is done, it is cleansed and we apply healing balm. And generally speaking, this screen takes anywhere between 7 to 9 days to heal. Let's see results after 4 sessions in 2 months before and afters, so you can appreciate it has worked.
What may be the biggest mistakes you're doing? It may be the cause for breakouts.
What not to do with acne. Let's see the 5 biggest mistakes that commonly encounter in clinics. Alright, you've got number 1. The biggest mistake is not using an active ingredient that fights against acne. Many active ingredients can clear your blemishes like benzoyl peroxide, adapalene, tretinoin, azelaic acid, topical or oral antibiotics, and oral isotretinoin. You can watch my video on how to clear up acne in 5 steps. It's about acne treatments. Most of the acne failures are using moisturizers and cleanser, but actually it doesn't have active drugs to clear blemishes. Salicylic acid is another commonly using acne treatment. It concentrates within the oil glands. It's lipophilic. It can dissolve in oil. Salicylic acids can penetrate the hair follicle, get into the sebaceous glands, and it breaks down the pimple ultimately. Salicylic acid product into your routine that you know may be a little bit of drying for you because it's breaking down those oils. Other acids that we're using are glycolic acid. It tends to be a little bit less effective for acne, even though they are keratolytic and break down comedones, less effective compared to salicylic acid. So use some of those with active ingredients. Let's jump in number 2. Picking pimples. I see this over and over again. A pimple is an inflamed bump, and so if you're going to go ahead and pick it some more, you're going to make the inflammation worse. So what can happen is, you can induce an infection on top of it. You can cause the swelling to get worse, which can then lead to worsening of redness and residual pigmentation. And the worst is scarring. And number 3. Not washing your face or overwashing. Wash your face every night. Make sure you take off your makeup. Make sure you use a cleanser. Makeup that is sitting on our face that can clog our pores makes things worse, so wash your face every single night. Stop overwashing your face. Overwashing your face with cleansers, these can overstrip your skin oil. It removes natural oils, making your skin dry. So limit your face washing to 3 or 2 times per day. Number 4. Using comedogenic or oil-based makeups. These will block the pores, ultimately give rise to acne. Instead, you can use non-comedogenic ones. Avoid blackhead pore strips. These will worsen acne. You can watch my video on this. Let's jump to number 5. Moisturizers. This is a big mistake. You can have acne oily skin and still be dehydrated, and so you need to moisturize your skin to maintain a healthy balance. If you have oily skin, you might want to go for a more water-based gel like moisturizer. So yeah, hope you guys enjoyed this video. Please feel free to press the thumbs up button.
I hope now you are interested in seeing how you get acne, what's inside it. Let us see what it is.
evolution of acne depends on the extent of inflammation. Mainly, there are 3 types of presentations: comedones, papular-pustular acne, and nodular cystic acne. Comedones are the initial step of the acne process. There is an increase in cell turnover at upper sebaceous follicles, leading to clogging of hair follicles. Increased androgens stimulate excess sebum production, shed keratin, dead cells. Sebum accumulates inside, leading to comedones. Comedones can either be whitehead or blackheads. Whitehead or closed comedones present as a skin-colored small bump consisting of dead skin cells, keratin, and sebum. Whiteheads are closed off from air and not exposed to the outer surface. Blackheads, or open comedones, present as black-colored small bumps consisting of dead skin cells, keratin, and sebum. They are open to air directly. Its dark color results from oxidized lipids and melanin. It is not from dirt or due to bad hygiene. Bacteria normally exist in our skin. They can flourish in clogged pores when sebum is abundant, leading to further accumulation, which appears as red-colored bumps and blemishes on your skin. It presents in the skin as papulopustular acne. Papules are red-colored small bumps. Pustules are lesions with a visible accumulation of pus in the skin. Pustules are closed pimples where inflammation follicles clogged with pus. In comedone phase, bacterial overgrowth is less compared to papulopustular acne. Nodular cystic acne is the most sinister form of acne, where there is marked inflammation in the papulopustular acne leading to this stage. There is further bacterial overgrowth, dead skin, and sebum production leading to ugly and disfiguring nodules and cysts. Cyst presents as large, painful, pus-filled lumps going deep inside the skin. This eventually leading to scarring, commonly manifests as acne scars.
What makes acne worse? Drugs commonly using for fits, psychiatric drug, prednisolone, picking and squeezing the spots, worsening acne. Don't prick, leave them alone. Milk products, diets high in sugar made acne worse. Don't eat chocolate, pizza, potato chips, ice cream. Exposure to chemicals like chlorine, petroleum compounds. Avoid oil-based makeup and skin products. Make sure that you are using safe cosmetics and makeup. Oily foods, yes, it doesn't cause acne. Hygiene. Don't worry, guys, it's obvious you are hygienic. It is not related to hygiene. Can anything else cause acne? Certain diseases in girls and women may cause acne or make acne worse conditions, like polycystic ovarian syndrome, rarely ovarian cancers. They usually associate with irregular menstrual cycles, obesity, excess hair in the body, change in voice, increased body muscle bulk. If you think you have these, consult a doctor.
How long does acne last? No one knows exactly how long acne will last for each person. Many teens find that their acne improves as they get older, and that it almost disappears by the time they reach their 20s. Others have acne well into their adult years. Some are actually due to sinister illnesses like Cushing's syndrome, which can be a manifestation of adrenal cancer. So it basically depends on what is the cause of acne. There is a huge list of syndromes that can cause acne. You can watch my video on acne for more details. So if you have a sinister underlying pathology that should be treated, that's number 1. If you have a mild form of acne, it will regress in 1 to 2 weeks with appropriate treatment. For moderate to severe acne, let's see how long it will take to clear them. First 1 to 2 weeks of acne treatment, you will experience peak of irritation and dryness. Treatment can limit the disease activity. Response is slow, usually takes 2 to 4 weeks for onset of improvement. You should also adhere to acne preventative measures. Sunscreen, moisturizers, and makeup should be labelled oil-free, non-comedogenic, or non-acnegenic. Hair and hairstyling products should be kept away from the face, and hair should be shampooed daily. Should try not to touch or pick at acne, and should avoid wearing tight-fitting hats or clothing over the acne-affected area. Resolution is linked to good adherence. It may take 1.5 months to 3 months for an obvious response, Stress is thought to play a role in acne. Cortisol is a hormone released by the adrenal gland in the body during periods of stress. Cortisol is thought to result in the body producing more testosterone and dihydrotestosterone, also known as DHT. Both of these hormones increase the amount of oil flowing out of your skin's sebaceous glands, thus in turn can lead to more blockages of hair follicles and the formation of acne. There is increased sebum production, which ultimately leading to acne formation. You can have red tender bumps and nodules. Stress also causes inflammation in the body in general, including the skin, which can worsen the appearance of pre-existing acne. If you have noticed that you tend to get acne when you are stressed, then it is likely that stress is a contributing factor for you. So don't stress with acne. We are here to help you.
If you are experiencing a breakout caused by stress, but you don't usually have acne-prone skin, you may need to make some pretty significant changes to your daily skincare routine. You need to incorporate ingredients that help to combat breakouts, like salicylic acid, benzoyl peroxide, and retinols. We can't avoid every source of stress in our lives, but we can increase relaxation. During these unprecedented times, finding ways to de-stress and relax can be just as important as actually treating skin conditions. If stress is causing breakouts, your first step is to make some time to rest and recuperate. Next, you need to start limiting your stressors. A few yoga poses or a quick dance party with friends watching comedy movies can work wonders in relieving stress.
An acne diet is also very important. Let's see what diet you should take.
So we're going to be talking about diet and acne. This is a very much requested topic. When it comes to your diet, it can really show up on your skin in the form of breakouts. This is really distressing. Acne is one of the most common skin conditions out there in both teenagers and in young adults. Diet and acne has been one of the most fluid areas of dermatologic research. Acne and acne breakouts. What's clear from the data is that when it comes to diet and acne, it's not any one specific diet or pattern of eating, but probably specific components of a diet that exacerbate acne for people who already have acne at baseline. We now have rigorous studies that suggest an association between a high glycemic diet and acne. One thing you will hear repeated over and over again is that acne is a consequence of a Western diet, whereas in non-Westernized areas of the world don't see any acne. What exactly is a Western diet? A Western diet is typically high in sugar, and high sugar processed foods have a lot of refined carbohydrates and are also high fat. Non-Westernized populations trend towards like Paleolithic type diet, where you don't have any dairy. It's very low sugar, no refined carbohydrates. There is virtually no high glycemic diet in non-Western populations. What exactly is a high glycemic diet? It contains carbohydrates that are fast digesting and raise your blood sugar very quickly, and downstream from that, raise insulin levels. Increases in insulin binds to receptors in your pores and triggers skin cell proliferation that clogs up the pores. It triggers proliferation of the cells that make up your oil gland, enlarging the oil gland and resulting in more oil production. Basically, there are two things you need to know in regards to diet and acne. The first is to find yourself unrefined food with low glycemic index. The second is to minimize high glycemic foods. Unrefined foods are things like grains, green vegetables, and fruits like grapes, peaches, oranges, pears, and apple should take as much as possible. Kidney beans, chickpeas, lentils, and bran breakfast cereals have low carbohydrates. Low glycemic vegetables include carrots, green peas, onions, lettuce, greens, green beans, tomatoes, cucumbers, bok choy, and mushrooms. If you're looking at carbohydrates, white rice, white bread, potatoes, sugar, sweets, pizza, wheat bread, and cornflakes are high glycemic foods and should avoid as much as possible. One of the worst culprits is the instant noodle. Meat, fish, and eggs you can add to your diet as you wish, as they have very low carbohydrate levels. The second thing is lactose. Lactose in dairy food can actually modulate the internal insulin, like growth factors. It increases the oil production, leading to acne. Well, the first thing I suggest is to cut back on dairy. Ice cream, cheese, and butter are the worst. Don't have cappuccinos when you can use organic milk.
Take a diet rich in omega-3 fatty acids, so fish and eggs are important. We know that omega-3 fatty acids are anti-inflammatory, so again it makes sense that this is helpful for those who are acne prone. In summary, to clear acne, instead of the white baguette, seek out whole grains. Instead of white rice, go for brown rice. Look at your carbohydrate intake and, where possible, stay away from unnaturally white foods that are rapidly absorbed and release sugar abruptly. You should boost your omega-3 fatty acid intake now because we know this to be an anti-inflammatory. Number 4, boost your zinc intake. The best way to do this is to actually seek out food that contains zinc, so keep a jar of almonds, walnuts, and cashews by your desk for regular snacking. It's wise to ensure that you're getting plenty of the colorful fruits and vegetables. If you are consuming a lot of sugary processed foods and you're on a treatment that's not quite doing well, the key is you have to stick to your anti-acne diet for at least 12 weeks to see any results. So don't expect to change your diet for a few weeks and then have your acne go away. Most importantly, favor a diet that prefers low glycemic foods over high glycemic foods. It has benefit to your overall health as well as your skin.
You must be taking vitamins on your own. This may be the cause for your acne. When it comes to using vitamins to supplement diets, there's a wide gap between what science says and what many consumers believe. Overall, almost 1 in 5 people in Europe are taking vitamins. Many of these people take over-the-counter supplements without professional advice, although a few practitioners prescribe megavitamin therapy. But most are vitamins not really useful when taken as supplements to a normal diet, unless you are deficient. In fact, each supplements are potentially harmful. Vitamin B12, or cobalamin supplementation, is used for many purposes, which is known to cause acne flares. A deficiency in vitamin B12 can cause serious health problems. Too little vitamin B12 has been implicated in anemia, digestive problems, and neurological problems such as numbness and tingling in the extremities, vision problems, and memory loss. Vitamin B12 is found in animal products such as dairy and shellfish. Vegetarians and vegans are advised to take supplements or eat enriched foods to get this nutrient. B12 and acne is well known, but the underlying mechanism has only been recently identified with excess of vitamin B12 supplementations. Propionibacterium acnes undergoes alteration of gene expression, rendering the bacteria pathogenic in inducing acne via the increased production of chemicals called porphyrins. Identification of the cause of acne is important. As for vitamin B12-induced acne, usual regimens are not successful. Cessation of vitamin B12 supplementation is usually curative. High levels of B12 in the bloodstream might make acne worse in certain individuals, not in all individuals. And again, it's important to note that a deficiency of vitamin B12 can have its serious consequences throughout the body and brain. So if you need B12 supplements, it's important to take them. It's very important than an acne flare which is not life-threatening.
Let's see what happens in pregnancy. During the first trimester of pregnancy, which starts from the first day of pregnancy and ends at 12 weeks, women's bodies release more of a hormone called progesterone. Progesterone has a similar effect on hair follicles as the hormones testosterone and DHT, in that it causes the sebaceous gland to expand and produce more oil, which in turn can lead to more acne-causing blockages, forming acne. Many acne treatments are not safe to use while pregnant. Benzoyl peroxide, azelaic acid, clindamycin are safe during pregnancy, while adapalene, tretinoin, and isotretinoin are contraindicated in pregnancy. If you are pregnant and acne is affecting you, you should speak to your doctor to discuss safe treatment options. In this video, we are discussing the effect that menstruation can have on acne. The average menstrual cycle is 28 days, and each of these days is different hormonally. In the first half of a woman's menstrual cycle, the predominant hormone is estrogen. In the second half, the main hormone is progesterone. During the menstrual cycle, levels of the hormone estrogen fluctuate in a woman's body from around day 14 until when the period is due. Estrogen levels in the body decrease, resulting in a proportionately higher level of testosterone. This imbalance in the hormones can result in testosterone connecting to receptors in the skin more freely and increasing the size of your sebaceous glands as well as the amount of oil that they produce. This, in turn, can lead to an increase in blockages of your hair follicles and a subsequent increase in acne. Acne-prone women experience these premenstrual flares. They usually strike about 7 to 10 days before the onset of a woman's period and then subside as soon as bleeding begins. That's all about acne and menstrual cycle.
There is a list of sinister causes of acne. If you are not clearing it in 4 weeks, I recommend you consult a skin doctor. Many cause acne. Sometimes internal cancers can present as acne. So you can see the video I made for medical professions. It's beyond the scope of the general population. Check the link below if you're interested. Please subscribe to my channel. Thank you. Bye-bye.